Please welcome Sara Whaley, Executive Director of Overdose Response for the City of Baltimore, Nidhi Sachdeva, Director of Strategic Health and Opioid Initiatives of the North Carolina Association of County Commissioners, J.R. Westberg, Bloomberg Fellow and Opioid Response Coordinator at the Hennepin County Sheriff's Office. In conversation with Aneri Pattani, Bloomberg Fellow and Senior Correspondent, KFF Health News.
Hi. Well, hello everyone. It's great to be here with you. We are here today to talk about opioid settlements. And just briefly, I know there are lots of you in the audience who know about this, who work with this. I know the folks up here eat, sleep, and breathe opioid settlements, but for those who don't, these are the settlements with companies that made and sold prescription opioid painkillers and were accused of fueling the overdose crisis. They are now paying more than $50 billion over nearly 2 decades, mostly going to state and local governments. And the governments are meant to turn around and use that money to invest in services and programs to address the addiction crisis. So it's a lot of money when we talk about, more than $50 billion. People say, that's a great opportunity, and it absolutely is. At the same time, as many of you know, it's not enough to solve the addiction overdose crisis. So I want to start off by asking you all, how do you target the money to make sure that it's being most effective in reaching the populations that need it most?
Yeah, so thanks, Aneri. I think you have to ask 2 questions. Is one, who in the community carries the highest burden of disease? And 2 is, where do we see the most opportunity for intervention? So in Hennepin County, which is the biggest county in Minnesota, like 1.3 million people, we decided to focus on really justice-involved individuals. So people coming into the Hennepin County Sheriff's Office in our custody, they have some of the highest rates of substance use disorder. Somewhere north of 60%. 80% have really acute mental health needs. And we have rates of chronic disease that are 4 to 5 times higher than the general population. So this is a really sick and ill group of people that are in dire need of care. So really focusing on interventions kind of behind the walls, looking at recovery, and kind of bringing in some of these public health strategies in the public safety landscape, working on some of these upstream issues. So I think that kind of targeted intervention not only improves the health of the individual, but also kind of serves a dual dividend of also fewer overdoses, reduction of recidivism rates, and then improvement in overall safety of the community.
Absolutely. Nidhi, what about you?
Yeah, I think when preparing for this panel, it was such an interesting juxtaposition because we've got, county level, state perspective, and city. And just this idea of being very honest about sort of what the landscape looks like within your state. In North Carolina, we have our North Carolina Memorandum of Agreement, which governs our settlement dollars in our state. 85% of our dollars go directly to local governments, which includes all 100 of our local counties, right? And we have mostly rural, and so we have to be really honest about what infrastructure exists within our counties and what we can build on. And I think we've done a really good job of trying to take a comprehensive approach and really featuring high opioid abatement strategies by pulling out strategies that we think are the most impactful. So we have sort of put at the top of the list access to medications for opioid use disorder, gold standard care. We know this stuff works. It's the cure for the leading cause of death for adults under the age of 50. Why do we not want to try to get this in all the possible places we can? And so how do we incorporate and integrate access to medications for opioid use disorder within our health departments that are already in all of our counties? How do we do our best to provide those services through community-based organizations like certain service programs or within our jails, understanding that this population is really, really highly impacted by many layers of challenges, right? And so we've been using really innovative approaches, including working with our EMS. Every county has an EMS service. And so how do we provide bridge programs and medications at the scene of an overdose, right? How do we offer that care and safety right there in that moment? And so that's been a really unique perspective in North Carolina. How do we just acknowledge and be honest about what we're working with here and then try to fill in the gaps where we can?
Right, so I'm hearing targeting folks who are incarcerated, targeting rural areas, and working with the infrastructure that exists.
Yeah.
Sarah, you have a little bit of a unique situation in that Baltimore settlement, within the settlement agreement, had earmarks that the money should go to certain organizations. How do you work with those organizations to make sure that the money had to go to them, but how are they still meeting the targeted populations that have the greatest need in the city?
Yeah, so Baltimore is a little bit different than the rest of the country because we didn't participate in the national settlement. So Baltimore pursued cases by themselves. And so we've won over $550 million for the city so far. And in those settlements, there were earmarked for $87 million for 22 organizations or programs across the city. And so you heard Dr. Taylor talk about the importance of data. And so the Baltimore City Health Department led on a citywide needs assessment, looking at both quantitative and qualitative data. So we were able to really see what the landscape looks like in the city. What are those populations that are most impacted? What are the geographic areas that are disproportionately impacted? And then we worked with each one of these organizations to talk about what they do really well, and how we can focus what they do into a scope of work that meets the needs that we're seeing in the city, and it can effectively and really purposefully use this money to fill in the gaps in service, to address the silos that we're seeing in care, to increase access to life-saving medication. We heard in the qualitative interviews that sometimes just having an ID was a barrier to getting MOUD. And so how do we work with these organizations and define a scope of work that addresses some of those issues?
Absolutely. So we all know right now there's a lot of political division. We've been talking about that at this summit, beyond. But the thing with the opioid settlements is we know the crisis is affecting all parts of the country, and the money is also arriving everywhere. Every county, every city almost is receiving some of this. So I'm hoping some of you can talk about how do you work with folks who have different political views, approach addiction in a different way. JR, you work within a law enforcement department. How do you talk about public health and public safety when it comes to this money?
Yeah, I mean, I think public safety is traditionally they focus on order and security and discipline and focus really on controlling the behavior of an individual, whereas public health is more about primary prevention, harm reduction, and I think more importantly, sort of patient or autonomy of care, and really and trying to tease out the underlying issues of that behavior. So sometimes those two ideas can come at odds, almost like a clash of cultures. So I think one of the things that I've tried to do is practice a harm reduction principle when speaking with public safety, sort of meeting them where they're at. And instead of starting the conversation off about a public health initiative that will improve the morbidity and mortality of people who use drugs, let's start with how this program can help you in your job, can make you safer, and thereby make the community that you work in safer. And then from there, you start to build out and introduce more kind of progressive, more public health related ideas. And this, the tagline I use all the time when talking to law enforcement partners is that a healthy community is a safe one, and a safe community is, by extension, a healthy one. So it's about finding that sort of common ground and working out from there.
Love that. And Nidhi, as you mentioned, you're working with a lot of rural areas in North Carolina, a lot of varied views, varied resources. What are the conversations you're having?
Yeah, I think we also have to be honest about how purple North Carolina actually is, given gerrymandering and all that. But so each community isn't necessarily a broad spectrum of political beliefs. I mean, our purple spaces tend to be a blue city within a red county, or just more urban counties tend to be bluer, and then the rest is a little bit more shades of red. And so I don't think we're actually that far away from each other. And I do believe that focusing in on sort of our shared humanity, the fact that at the highest peak, I think at most 11 people in North Carolina were dying every single day from drug overdose, that it was very easy for us to say, we all care about this issue. We all want our communities to be safe. We've all felt it in some way, and that, I think, sort of softens the conversation really quickly, because they're like, oh, yeah, my son or my cousin or my neighbor or my friend or my classmate or whatever. And so I think it's more struggling with updating people's understanding of what the evidence is. It's like, well, when I was a kid, this is what I learned, but now we know more. And so how can we transition the conversation away from what was into what we know works better: harm reduction, evidence-based strategies, access to medications, and really just going to the root causes. Right? Drug use is really a symptom of much deeper societal ills. And so how do we do our best to address the underlying root causes of that? Talk about housing, talk about employment, talk about meaningful connection with community, which I think is very relatable regardless of where you are on the political spectrum. And so just getting down to the stories, like it was said earlier today, is just how do we acknowledge the shared humanity. And we all don't want to feel pain. And in North Carolina, we've offered sort of a hope and vision for North Carolina that we hope that with the investments of the settlement, that all people in North Carolina will be healthy, that they'll be connected to supports and services within a culture of care. And most people are like, oh yeah, that sounds cool, sign me up for that. So that's been, I think, a really easy way to soften the conversation.
And then Sarah, it's always a little special with Baltimore. So I know Baltimore has certain ambitions with this money, such as an overdose prevention center, that are sort of at odds with the current federal administration and their views. How do you keep moving forward and work within that?
Yeah, so I feel really lucky to work for a city where we have an administration that is very supportive of evidence-based programming like overdose prevention centers, and even in a space where the federal administration or even some of our colleagues across the city are hesitant or unsure of those evidence-based programs. I think as we think about opioid settlement dollars and how we use them, the thing that we try to focus on and move forward with every day is the processes that we are building out. So no matter what we invest in, we have the processes and the data to show that we've made smart investments with our money and that they are working towards those shared goals that Nidhi talked about. And I think in Baltimore and across the country, we have to acknowledge that the reason we have this money is because people lost their lives. Families lost loved ones, and so we have to be good stewards of that money. And so really thinking about building out good processes, finding the data metrics to tell the story of what our investments are. And so no matter what we invest in, we're able to share that story publicly and really be good stewards of this money.
Absolutely. Well, I'm going to encourage anyone who is working on opioid settlements or interested to come and talk to these folks later. There's a lot more that we could discuss, but for now, thank you all for this great conversation. Really appreciate it.
Thank you.